Bit of it.
So I've got a question for you. This is Lee Carter.
Hey, Lee.
We're trying to get off the Russia topic and get back onto health care. This week we're expected to go to a vote. What do you think they're going to vote on, and why can't we get something done?
Well, we can't get something done, quite frankly, for one reason, is that both parties are guilty of taking millions of dollars of campaign contributions from the big insurance companies. And if you look, and this is never talked about, but if you look at Aetna, Cigna, and United Healthcare, who helped to write Obamacare, their stocks over the past 5 years have tripled. They have advanced more than Apple. Are you going to tell me those health insurance companies have done more for America than Apple? And they have got to be asked to do a lot more. And frankly, they have a lot of political sway in Washington, and that's one bit of reason nothing's done. The other is health care is very important. It has to be kept in mind that the Obamacare only affects about 7% of the population. That's significant. It's millions of people. We've got to take care of them. But the vast majority of Americans get their health care from their employer or from Medicare or the existing Medicaid before the expansion. But we have got to fix it. My personal preference, Lee, is that we repeal the existing bill as best we can with reconciliation, and then Republicans work with Democrats to forge a bipartisan replacement. You should not do something as big as health care on a party line vote. That was a mistake that Barack Obama made. Look what's happening. They're dismantling it quickly. You know, 52 years ago, almost exactly, President Johnson pushed through Medicare. He had a much bigger majority, had a two-thirds majority in the House and Senate of Democrats. He didn't need any Republican votes, but he refused to make it a party line vote. He enlisted a lot of Republicans to vote for it because he knew they had to have skin in the game.
Yeah, here's Lindsey Bell.
Well, how are you going to get the Republicans to work with the Democrats when they can't even work together? You have the Republican Party so divided. How do you get them to come together and come up with a plan?
I think it will actually be easier, believe it or not. I think we have people, unfortunately, in the Republican Party, and I vote Republican, and I'm a big supporter of President Trump, but regrettably, we have a lot of Republicans that don't really want to reform this health care system. They want it to go away. They think Obamacare was a mistake, which it was. But the one good thing that it did is it brought to the fore that we have to take care of the uninsured people in this country. We have to have real health care, which is what President Trump campaigned on, a beautiful system that takes care of everybody. So, you know, there are a lot of ways to take care of this. As I said, the insurance companies, they operate protected from antitrust in a monopoly or an oligopoly environment almost everywhere in the country. They're prodigiously profitable. They have got to be required to do much more. We have got to combine the Medicaid population with regular insurance populations instead of having a lower tier of providers.
You're making a lot of important points. These are all really important points for sure. But, I mean, tax reform is what the economy wants to see, the markets want to see. The Hill is reporting former House Speaker Newt Gingrich is teaming up with small business owners to pressure Congress for tax relief. I spoke with Speaker Gingrich yesterday, and he basically said, let's do a timeout and look at the first 6 months of the administration, and Senate, the House, and the President has to ask themselves, is the last 6 months what we want to see in the next 6 months? If not, we do a reset. Here's what he told me on Sunday Morning Futures yesterday.
I think the first big change is to really emphasize by Thanksgiving having a tax cut bill signed into law, which means it has to be fairly simple, fairly straightforward. I think they ought to drop tax reform as a goal, go to tax cut as a goal, recognize that if we don't have economic growth in the first and second quarter of next year that proves we're the party of jobs and prosperity and take-home pay, we could lose the House and be faced with Speaker Pelosi for the last 2 years of this term.
Is that realistic to get a tax reform, or maybe just make the gold tax cuts, get that done by Thanksgiving?
Well, nobody in America knows more about driving through legislation successfully than Newt Gingrich.
You're right.
If he says it can be done by Thanksgiving, it can. The studies show that small business owners say that's their #1 priority is tax reform or tax reduction, and that they would invest 70% of their tax savings in their businesses, in new hiring, in raising incomes. As I said earlier, we've had stagnant worker incomes in this country for over 20 years. A lot of that's due to our horrific trade deals that we've made and the illegal immigration that's undercut wages at the bottom tier. But we have got to fix that. I totally agree with Newt. It can be done. I do believe, though, we've got to reform health care. It's too important. It's too big an issue to sidetrack.
Yeah.
I think we can do both. I actually think they're tied together. Frankly, I think we need to take a very serious look at a trade tariff. We import nearly $2.2 trillion worth of goods in this country.
Do you want the border adjustment
we need
tax?
A tariff on that.
Do you want the border adjustment tax?
I don't want that, because the border adjustment tax is a whole other tax regime.
Okay.
We're trying to simplify taxes on top of the existing tax system. The businesses would have to calculate that separately. Crazy. We've done tariffs for centuries in this country. A 10% tariff would yield $210 billion. That would get us a long way toward being able to actually cut income taxes, fund a health care system that actually works. It's based on private insurance, but gets rid of the coddled insurance industry that we have now, makes them do more.
Lee, great to have your insights this morning. Thanks so much. Lee Speakerman
great to join you.
joining us there.